Man, these COVID death rates are nonsense anyway, bro. Huh? Yeah, man, I had an auntie who had cancer. They put COVID-19 on a death certificate. You sure? My friend was hit by a truck. They put it as COVID-19. I don't know. Hey guys, my name's Omar Al Hassan, your friendly neighborhood doctor. I just thought I'd make this video because I've been asked a few questions about the COVID situation, having worked in the hospitals during, the COVID pandemic. People have asked me a few questions and it tends to be similar questions over and over again. So I thought it might be useful to try and explain some things to some people. So as the title suggests, I'll get a lot of doubt from people that I know about the real death rates of COVID. Like, is it really true that it's killing that many people? Or are doctors just writing COVID for everything that happens in the hospital? Slip over, trip, and hit your head, COVID death. You die of cancer, COVID death. Is that the case? So I think we need to understand that it's actually quite difficult to calculate the death rate of a disease. It seems like a very simple thing to do, but it's actually quite complicated. And that's because it's very difficult to judge exactly what has killed a person. Some cases very obvious, some cases are quite complicated. Take for example, you had a chest infection and 48 hours later you died of that chest infection because you couldn't get enough oxygen into your blood to give enough oxygen to your body, into your organs. It's pretty obvious in that case that the chest infection caused the death, especially if there was nothing else going on. What about an example whereby you had a chest infection? That chest infection causes scarring in your lungs. 3 weeks later, because of that scarring, you get a clot in your lungs. That ends up causing your death. Did the clot kill you? Did the chest infection kill you? Did the scarring kill you? Or was it a mixture of all of them? We could all probably agree that the chest infection contributed to the death, but maybe it wasn't the direct cause of the death. Let's see what the WHO, the World Health Organization, has put as a definition of a COVID death. Now, I haven't remembered this off my heart, so I've got it written right here. A COVID-19 death is defined for surveillance purposes as a death resulting from a clinically compatible illness in a probable or confirmed COVID-19 case, unless there is a clear alternative cause of death that cannot be related to COVID-19, for example, trauma. So what it's saying there is, for the purpose of surveilling the disease, so seeing what it's doing to the population, we need to count the deaths as anything that's being caused by COVID leading to death. So for example, COVID has lots of different effects that we've discovered throughout the pandemic. Obviously the most common thing is COVID pneumonitis, which is essentially an inflammation infection of the lungs that causes the lungs to essentially be unable to get oxygen into the body. But COVID can also cause clots that can go into the brain, into the heart, into the kidneys, etc., etc., causing organ damage, and then that organ damage can cause death as well. If someone has probable or confirmed COVID, unless there is an obvious alternative cause, then it's not unreasonable to suggest that COVID was the cause or contributor to the death. You can sense there's a little bit of uncertainty there, and that's because sometimes there is when we're trying to figure out what caused someone's death. Oftentimes it's lots of different factors that contributed, and COVID may be part of the cause or the main cause of the death. So who is counting? Well, there's two main groups that we need to be aware of. There is the ONS, the Office of National Statistics, and there is PHE, Public Health England. And these are two organisations that are keeping a track of the COVID deaths in the UK. They're probably the most relevant. There might be some others. Let's look at how they calculate it. See, the ONS, the Office of National Statistics, will try and keep an eye on the number of deaths caused by anything. So what they will do is essentially keep a database of causes of death by looking at the death certificates. And a death certificate is a document doctors will issue once someone has died, stating the cause of death, etc. We'll come on to that topic in a little while, so keep tuned. So they will look at the death certificates and see if COVID-19 is listed amongst the causes of death. And they will count that as a COVID-19 death. Public Health England look at COVID positive swabs, so when someone is tested for COVID, and they'll look at if that person dies within 28 days, that can be counted as a COVID-19 death. Or within 60 days, if on the death certificate COVID-19 is one of the reasons. So we can see that there's two separate ways of counting the causes of death that Public Health England and the ONS do. And they will have advantages and disadvantages. And I think sometimes people misunderstand that there's a difference between these things, and therefore there's probably people just making it up as they go along. Well, no, it's not quite that. There are different ways of working it out, and therefore slightly different numbers. And I think the discrepancy between these numbers causes people to be confused, and that leads to doubt, which leads to mistrust, and then it leads to people, latching onto kind of any information that they think they might be able to trust, even if it's not from the most reputable sources. And that's the reason I made this video. Next, I think we need to look at death certificates and figure out how they're done. For most people, you probably won't ever have come across a death certificate unless you've been unfortunate enough to have to register someone's death, and that's usually someone who's quite close. But death certificates are something that are filled out by the doctors when someone passes away. In hospital, the hospital doctors do it. In the community outside of hospital, GPs tend to do it. They are checked by different people. So all hospitals now have a medical examiner who will look at the notes of the person who passed away and look at what's happened recently and try and ascertain what the cause of death is. They will also work with that patient's consultant, who has been looking after the patient on the ward with the ward team, and they will come to an agreement on what they think the likely cause of death is. We also have coroners who look at cases that are a bit more complicated, and where certain things have happened, or the death was unexpected, or came after a surgery, etc. Most deaths, however, don't go to the coroner. So I'll bring up an image of the death certificate. Hopefully it should pop up around here somewhere. And you can see that there are 4 boxes for writing the causes of death. There's 1A, 1B, 1C, and then 2. So 1A is the primary cause of death, the thing that we think caused the person to pass away. So that might be a clot in the lungs, going back to our example earlier. 1B is something that might have contributed to 1A. So the person might have had lung cancer that makes you more likely to have a clot, and we think that contributed to the person having a clot. 1C are the things that might have led to 1B. So for example, lung cancers can be caused by asbestos exposure. So that might be put in there. So 2 are things that didn't contribute directly to the cause of death, but perhaps to the overall picture and reduce the patient's ability to fight the thing that eventually killed them. It might be, for example, liver failure or kidney failure, or other conditions that might have made them more likely to get the cause of death, or less able to kind of combat it. So that was a rough overall look at how death certificates work and how death rates are calculated for various diseases, including COVID. Feel free to ask any further questions in the comments, or ask about any other medical questions, and I will try and address them in a future video. Thanks for watching, hope it was helpful. Until next time.